Community Health Center. Bonjour à tous et bienvenue au Centre de santé communautaire de Centre-Ville. I want to begin by acknowledging and honoring that we hold this meeting on the unceded Algonquin-Anishinaabe territory. C'est un honneur. Nous aimerions reconnaître et honorer le fait que nous tenons cette réunion sur le territoire non cédé de Algonquin et des Anishinaabe. As we think about this from a community health center perspective and as a land acknowledgement, we also just need to recognize that within Canadian healthcare, but also in healthcare systems around the world, Indigenous people are often having the poorest health outcomes because of the systemic barriers in our healthcare system. And so this announcement, as we're looking at today, I think has, one of those impacts to really change. Here at Centretown Community Health Center, as I've been touring the minister around today, Roy Romano once said in his report that community health centers are the best kept secret in the Canadian healthcare system, and I have to agree. We are one of 75 community health centers in Ontario that provide a broad range of comprehensive primary and social services healthcare. This includes services to families and individuals who live and work in the communities that we serve across Ontario. All of us pay particular attention to groups facing barriers to accessing health care, including here at Centretown, where we focus on the needs of individuals who are seniors, the 2S LGBTQ+ community, those affected by mental illness and substance use health issues, and people who are homeless and newcomers to Canada. So today it is absolutely an honor to have the Honourable Mark Holland, Minister of Health, and the Honourable Marcy Ayen, Minister of Women, Gender and Equality with us today to make an announcement. We are pleased to host you. Over to you, Ministers.
Merci beaucoup. C'est absolument un grand plaisir d'être ici pour un jour vraiment historique pour notre système de santé, mais aussi pour la justice et l'équité et la laborabilité partout au Canada. And I have some thank yous to start with. I want to start by thanking Michelle at the Centretown Community Health Center for hosting us today. I'm going to come back, Michelle, in a minute to talk a little bit about that. I want to thank some of the incredible advocates whose shoulders upon which we stand. Their advocacy is why we got here. I want to thank Dr. Tour from Calgary, whose passionate and relentless advocacy for universal contraception was absolutely essential. I want to thank Dr. Wendy Norman from UBC. Wendy, over there. Wendy kept telling me, Mark, this is so important. You have to do this. I know that Don, similar things would have been said to you, and we had to hold inside our vociferous and enthusiastic agreement. And so thank you for all your patience as you said that. To Frédéric Chabot from the Canadian Action Canada, for sexual health and rights, who's also been such a staunch and powerful advocate. Dr. Black from the Society of Obstetricians and Gynecologists of Canada for all of your advocacy. And then I got to turn to the community of diabetes. And there are so many people that it's impossible for me to be able to name anybody individually. But I really want to thank hugely Diabetes Canada and JDRF for their relentless advocacy to get us to this moment today. It wouldn't have been possible without them speaking up on behalf of patients. And, I also want to recognize Raina, who I'll come back to. Raina, who's a 12-year-old advocate for JDRF. I want to thank my colleagues. I obviously, Marcy and Yasser, but all of the colleagues whose relentless push to move forward was so instrumental in this process. It is such an honor to work with all of you. We have such an extraordinary team. I'm so proud to serve with under our Prime Minister. And Don, maybe you'd come over here for just 1 second, because I want to first start by shaking your hand. Don, it's rare in politics. We're two different parties. Obviously, we have a lot of different views on a lot of different things. But, over the last, 8 months or thereabouts, they were very vigorous conversations. They were very hard conversations. There were many moments where I think both of us wondered if we would get here today, but we did. And it's a testament to who you are, Don, to your focus on trying to make things better and trying to find solutions instead of find differences. And I really appreciate and honor you in that. It was a privilege when I was a critic in opposition to work with you on public safety issues, whether or not it's on dental or here on pharmacare. I think we're able to do tremendous things by finding that common ground. So, Don, thank you so much. Aujourd'hui, comme j'ai déjà dit, c'est un jour vraiment historique. C'est un jour historique d'augmenter la santé pour tous les Canadiens et les Canadiennes, avec un impact énorme pour notre système de santé. You know, when we think of the pandemic and the stresses faced by healthcare systems around the world, it's easy to despair, to believe that the strength of our public health system and its best days are behind us. But, you know, in that moment in the pandemic, instead was seen a light of what was possible when we all work together, when we focus on collaboration and we focus on solutions rather than on differences, egos, and jurisdiction. And it is exactly that spirit that brings us here together today. And you know, you think about the advancements we're making, having signed agreements now with British Columbia, Alberta, Manitoba, Ontario, Prince Edward Island, Northwest Territories, and Nova Scotia, and every province and territory to come, to make historic investments. $200 billion being invested over the next 10 years in our public health care system. But we recognize investing in primary care, investing in ensuring that we have the right workforce and that we stand with the incredible individuals who provide us health care in every corner of this country every day is not enough. That we must cast our eyes upstream. Being upstream is just as important as dealing with the conditions that we're dealing with in the current context. That's why our government took historic action on bulk purchasing to reduce the cost of drugs in Canada by hundreds of millions of dollars. That's why we took action on drugs for rare diseases. And that's certainly why we took action on dental care, and it's most certainly why we are here today. Today in the House of Commons, I was deeply proud to introduce an Act Respecting Pharmacare that lays out the principles essential for a national universal pharmacare in Canada and sets out our plan to provide universal single-payer coverage for a range of contraception and diabetes medications. And someone might rightfully ask, why these two drugs? So let me take them each in turn. Let's start with sexual health. And here I turn to the advocates who've spoken so passionately over the years about how autonomy over one's body, over the ability to have access to the reproductive medicines that you need to control your own sexual health is a matter of fundamental justice. Waking up in a country where every single woman has access to the contraception she needs to control her future is an absolutely critical part of having a just society. This is about health equity. It's also about affordability, about making sure somebody who's asking, can I afford the contraception that I need to be able to control my future? Or do I pay for rent or food in a time of global inflation and challenge? It's about giving women control of their own bodies. And folks, it's also about destigmatizing conversations about sexual health. Sexual health is health. We should have the ability to talk about any body part with no shame. And those direct, honest conversations about our sexual health are so essential. Because when we avoid conversations about sexual health, that leads us open to manipulation, to sexual violence, and poor health outcomes. There are more than 9 million women of reproductive age in Canada. That's nearly a quarter of the population. Unintended pregnancy can be a cause of a cascade of health and economic impacts, both for individuals and for society. Having safe, reliable birth control is essentially freedom, and it is safety. However, these costs continue to be a barrier. Today, we're taking action to remove that barrier. Next, I'll turn to diabetes. And maybe if I could go to one of the most powerful advocates here in the room today. 12-year-old Raina. Raina said to me, she was talking about how hard it is to manage diabetes, how much work has to go in and thought every day to managing your condition. And that's a lot for a 12-year-old person to deal with. But Raina reminded us that imagine at 12 years old, as you're trying to manage that very difficult disease, if you wonder whether or not you can afford medication, if you wonder whether or not you can afford the test strip or the syringe that you need, you got enough to worry about, Raina. You don't need to be worried about cost. And that's one of the reasons why this is so fundamentally important today. You know, when I had an opportunity to talk to Sarah here earlier today, Sarah is doing incredible work in diabetes, as so many are at the Centertown Community Health Center. Sarah was saying to me, imagine I have clients who, because of money, are reusing syringes, taking on the danger, the incredible health danger of reusing a syringe because they don't have the money for it. That's not right. That's not the kind of country we should live in. Talking about patients who are making a decision about whether or not they take their diabetes medication or whether or not they go and get the food that they need for their family. And what happens to that person who doesn't take their medication? Right? They wind up potentially with an amputation, with a stroke, with a heart attack. They walk out with potentially kidney problems. That's not just a matter of social justice. Imagine the cost involved in that to our health system. And I don't think that's the kind of country we want to have. And that's fundamentally about what we're talking about today. And here I'll make another point, which is that many will talk about how much this costs. I hope we talk about how much it saves. Not just how many lives it saves. But in the British Columbia example, and I want to thank Adrian Dix, who was, the work that British Columbia did to lead the way on universal contraception, has demonstrated really that it appears to be saving more in money than it costs. Here's a remarkable situation where we will work with provinces. Je vais travailler avec chaque province, avec chaque territoire, avec un esprit de coopération, d'augmenter les préventions, parce que c'est de réduire le coût pour notre système de santé. That's what's remarkable about this. If we think outside of the crisis we're in, we can light a candle to what is possible in our health system. While we make the investments in primary care and health workforce, we so too could be making the investments that are stopping the crisis from ever happening again. This is fundamentally an important day for Canada. It is one for which I am so deeply proud. And I will end on this note. And I usually don't write things, but I wrote this. If I can find it. There will be a debate, folks, and we know this has already started. There will be a debate about who gets credit here today. Is it the Liberal Party? Is it the New Democratic Party? Is it the advocates or a particular province? Or someone or something else altogether? This debate entirely misses the point. This deal was achieved because our parties, every day, in every way, centered the conversation on how we can make things better. It was our only focus. We asked, how do we stand on the shoulders of all of the advocacy and work that was done before us to find answers and not differences? We found common ground only because we put our partisan interest and consideration last. I think that's what Canadians want. They want us focused on impact, on making a difference, on finding common ground. In a world of challenge and change, in the midst of global turmoil, the easiest thing is to say what's wrong and find conflict. The lazy choice is to criticize and pretend that magical answers exist to fundamentally challenging problems. The hardest thing is to offer solutions, to take on the vulnerability and weight of compromise and fair exchange. Our contribution to the extraordinary Canada of tomorrow is progress. Progress like we've made here today. Progress like we've made in dental care. Progress in our agreements on health with provinces and in so many other areas. Folks, we will be all forgotten. That's just a fundamental reality. But the progress we make will forge a prosperous and joyful tomorrow beyond all imagining. Each increment of progress will evolve us ever closer to that end. Each movement forward takes us closer to becoming a nation worthy of our highest ideals. Today is a giant step forward for our health system. It was made possible by two adversaries asking what we have in common rather than what separates us. It happened because we rolled the dice that cooperation yields more than conflict. I hope that it represents the politics of our future. It certainly made the history of today. With that, it is my great pleasure I also want to really thank the extraordinary team that I work with. Really thank you for all of your extraordinary work. It's just such an honor and privilege. And with that, it is my pleasure to turn it over to a very worthy adversary as we debated all of this, the Member of Parliament and health critic for the Democratic Party, Don Davies.
Well, good morning, everyone. That's one tough act to follow. Much of what I'm about to say, I think, will emphasize the remarks we just heard from Minister Holland, and I think that in a very real, tangible way illustrates the very points that Mark's making about finding common ground. Today is truly a historic day. For far too long, millions of Canadians have struggled to afford the prescription drugs they need to stay healthy and, in some cases, even alive. They've had to make the tough choice between paying for groceries or rent or the medication they need. They've been forced to skip or ration medicine essential for their good health. And they have faced among the highest prices for prescription drugs in the world. Today, that changes. After decades of unwavering commitment and effort by so many, we are delivering on the mission to bring prescription medication into our universal, single-payer healthcare system. In doing so, we have taken inspiration from the example set by Canadian researchers Sir Frederick Banting and Charles Best. A century ago, they discovered and secured the patent for insulin, a breakthrough discovery that revolutionized diabetes treatment. Remarkably, they sold it for $1, refusing personal profit. They did so because they firmly believed that insulin belonged to humanity, not to themselves. Today, I think we're honoring that legacy by creating the pathway to ensure that no Canadian will be forced to suffer because they can't afford their medication. For the first time ever, Canadians will be able to access insulin, diabetes medications and devices, and contraception as a matter of right and not privilege. This means that women will have better control over their reproductive health and more freedom to determine their own futures. Parents will be able to drop off their diabetic children at school or daycare without fear, knowing that they can monitor their glucose levels in real time from their phone. I've heard this example before, but Reina reinforced this powerfully today. If you think about a parent having to wake up their child every 90 minutes at night to test their blood sugars and what impact that has on the child and the parents and the family, now we can make sure that that child has, every child like that, has a continuous glucose monitor and an insulin pump. Canadians will be able to walk into a pharmacy, present their prescription, and walk out with the medicine and devices they need without any copayment or deductible on a universal basis through our public system. This is a game changer for millions of people. But we can't stop until every Canadian can get the medication they need with their health card, not their credit card. That's why we've ensured, working together and collaboratively, that today's legislation also lays the foundation for a truly comprehensive single-payer pharmacare plan, a program that will cover all medically necessary pharmaceutical products for all Canadians, regardless of where they live, whether they work, or how much they earn. I want to emphasize that this initiative is not only incredibly important to Canadians' health, it's also a smart economic measure that ultimately will save our healthcare system billions of dollars once fully implemented. Like Minister Holland, I want to thank all the stakeholders who made this day possible through your tireless efforts and advocacy. Healthcare providers, unions, researchers, patients, retiree groups, business leaders, and countless others. You have been the driving force behind this movement. Your faith and dedication have been truly impactful. I would like to thank my leader, Jagmeet Singh, for his strong support of public health care and his deep commitment to make it better. I also wish to thank my Liberal colleagues, and in particular, Health Minister Mark Holland, for coming to the negotiating table with a generous and positive spirit and working in good faith for the benefit of all Canadians. Mark, your collegiality, your skill, your cooperation were instrumental in making this day a reality. It simply would not have happened without you. Thank you, Mark. I agree. Today's announcement underscores the immense potential that we can unlock when we collaborate to fix our country's problems. Finally, I'm thinking of our late leader, Jack Layton, who taught us that it is every MP's most important job to make Parliament work for Canadians and always to be optimistic. I look forward to continue to working together to build the high-quality, comprehensive, head-to-toe public healthcare system that every Canadian deserves. Thank you very much.
It's never a good day when I have to follow you two. That's not fair, but it's an honor. It is such an honor. Hello, everyone, et bonjour tout le monde. Merci, Michelle, and your team. I said ton équipe. Pour cette merveilleuse introduction. Et merci à mes chers collègues, le ministre Holland, le député Yasser Naqvi et le député Don Davies pour votre travail. And to all of my colleagues here, there are so many of you, to all of my colleagues here, fellow MPs, thank you so much for your support. It is an honor to work alongside you each and every day. So Minister Holland / Mark laid out just how transformational this first phase of the National Pharmacare program will be for Canadians and how many lives this will change. First, I want to give a special shout out to Sonia Sidhu, a Member of Parliament for Brampton South. And Sonia, when I started a couple of years ago, I knew immediately how much of an advocate you were with regards to diabetes and diabetes care, the bill you put forward, but the work that you do in Women's Caucus as well. I want Canadians to know that there are parliamentarians like Sonia that have been doing the work for years, tirelessly, and representing 3.7 million Canadians, you lovely, among them, living with diabetes. So Sonia, thank you. Merci beaucoup. So I'll just take a moment to speak about what this means for women and girls and what this means for reproductive rights in this country. Ce que cela signifie pour les femmes et de ce que cela signifie pour les droits reproductifs au Canada. Making contraceptives free for women right across this country will mean full coverage for oral contraceptives, copper and hormonal IUDs, injections, implants, rings, morning after pills, and they're expensive. This is a big deal because we know that women, especially from rural, northern, and remote communities and from lower income communities, do not have the same level of access as women in middle class or urban centers. We know that people still make decisions about what contraception to use based on the price. Can I afford this or can I not afford this? And not based on what is best for them. In the words of advocates from Action Canada for Sexual Health and Rights, and I wanted to quote them, being able to control your fertility shouldn't be reserved for people who can afford it. This is about making life more affordable for women and making sure that they can make decisions about their own reproductive health. And over the longer term, it will save our economy and our healthcare system millions of dollars by avoiding unwanted pregnancies and better access to resources to make better health decisions. Et un meilleur accès aux ressources nécessaires pour prendre de bonnes décisions en matière de santé. Next week is International Women's Day, and every year we acknowledge all of the incredible things that women do in their communities, for their communities, how they serve their communities, in spite of the expenses and responsibilities that they have. This right here, this Pharmacare program and its universal contraceptive coverage is a concrete step toward true and lasting gender equality, and that cannot be understated. Again, as Minister Holland said, we are talking about 9 million people. 9 million people of reproductive age. That is a quarter of the Canadian population. People like Dr. Rupinder Tour, the founder of the IUD and Women's Clinic at the University of Calgary, is here. And she said something that I think all Canadians need to hear, and I quote, "I have seen how access to contraception can change lives for a lot of vulnerable people. Life is something that just happens to them, and they don't get to choose what happens." What we're announcing here today is putting agency back in the hands of people and putting that choice within reach. So I want to end by taking this opportunity to thank everyone that's here today, the generations of women that have fought to make this a reality. It is on the shoulders of so many champions, including the Honorable Dr. Hetty Fry, activists, experts, people dedicated to making sure that the next generation of women don't have the same struggles, that we're able to achieve great things like this. This is also about what happens when collaboration happens. This is how we serve Canadians in the best possible way, when we do it together, like this. Merci beaucoup.
Well, all powerful acts to follow. Good afternoon, everyone. My name is Yasser Naqvi. I have the great honor of serving this community of Ottawa Centre as their Member of Parliament, and I'm so excited that all of you got to experience a little bit of the Centretown Community Health Centre, which is an amazing place. Many moons ago, before I got into politics, I had the honor of being on the board of Centretown Community Health Centre, and I really saw firsthand the impact they make on a daily basis on lives of people who live just outside these doors. And it is so exciting to be here and to bring my colleagues along also, so they can see a little bit of the magic in our community. I stand here to speak on behalf of all my colleagues who work hard every single day. There's no underestimating the significance of this announcement and what it means for Canadians. We are living through some really troubling times. Change is all around us, and you can feel the anxiety among people when you speak to them, when you go visit them at their doors or even at a grocery store. We're still struggling through the impact of the pandemic. Still is felt every single day. Affordability of life is a real thing. And people's confidence in a healthcare system is shaky at most of the times. So we have to do everything in our power to restore that confidence, to make sure that Canadians know that their governments at all orders are working hard to ensure that they have good publicly funded healthcare available. So whether it's investing and bringing forward a Pharmacare plan, as we are announcing today, whether it's investing in our Canadian dental care plan, we are telling Canadians that we are there to make sure that our healthcare system is there for them. We are choosing to be pragmatic, not dogmatic. And that is the work that we were elected to do, and that is the work we are all doing by working together with every parliamentarian who wants to work with us. And the result is that we will help many, many Canadians for generations to come. Thank you very much for being here. Thank you for coming to Centertown Community Health Center. I am going to now pass the mic to our good friend Chris, who will now moderate the media for the easy part of this announcement. Thank you very much.
Thank you so much. Thanks so much. Merci beaucoup. We'll start with the questions in the room. You have one question, one follow-up. If you can just state your name, your outlet, and who your question is directed towards, please. Thanks.
Thank you. Marika Walsh with the Globe and Mail. My question is for Minister Holland. On the documents that we saw yesterday from the Winnipeg lab, I'm wondering if you can clarify what's happening now. After all of you learned, has the government closed the door on all collaborations between infectious disease researchers at the lab and China?
Thank you for the question. So the short answer is yes. I mean, the environment has changed dramatically. I think in 2019 there was still an enormous amount of collaboration that was occurring. I won't say there's no collaboration, but the nature of that collaboration is totally different as it's become apparent that there are efforts for them to impact our scientific community. And I would say as well that this is a example. The Public Health Agency, which is an extraordinary agency that does incredible work, hired 2 Canadian citizens who were eminent scientists in their field who lied, misrepresented themselves. And it was the Public Health Agency that identified that, found that out, and there is a process right now that's ongoing to determine by the RCMP and otherwise what those actions, those misrepresentations meant in terms of what their intentions were with it. But it's deeply sad and disturbing that 2 eminent scientists who were Canadian citizens would do such a thing.
Sorry, I'm confused by your response. You said yes first, but then you said you won't say that none of it's happening. So can you clarify? What is the ban on collaboration with China, and when did it start, and what does it cover?
Yeah, I think that, there would have been, when we're talking about infectious diseases as an example, there is all sorts of international collaboration. So I walked it back a little bit because I want to be careful that there are many things that are happening with the WHO and different lower level interactions that might be occurring. I'll give you exact precision on that. I just wanted to be careful, and that's why I was saying that. But I think I want to really make sure that when we're talking about exchanges that would have occurred for example, viruses that would be in a level 4 laboratory, that in the past we would have, shared samples and we would have been engaged in that kind of exchange at a level 3 or level 4 lab. That obviously has ceased, and part of the reason for that is learning that the Chinese government is making active efforts to infiltrate our scientific community for purposes that are not for collaboration.
So can you clarify, so there's no bilateral collaboration? For example,
well, I think
those scientists were doing publications with Chinese military researchers. So are there still bilateral collaborations between Canada and China?
I want to get back to you with precision in terms of exactly what those would be. I just wanted to characterize the distinction between what might be happening as a global community with the World Health Organization and what would be happening with respect to serious pathogens that would be pathogens of concern for national security purposes.
I'm Minister Kyle Duggan from Politico. There are 2 provinces that have said that they plan to opt out of this. How do you plan to deal with that, and will you still offer them the bulk of the money for these drugs?
Yeah, thanks so much for the question. I had an opportunity. There was a brief period of time because of the blackout that's imposed by introducing legislation and the fact that we don't want, we wanted to be careful about what got out. So I had a narrow window to talk to my provincial and territory counterparts, but I've spoken to every single one of them. The only one that I haven't spoken to directly on this legislation is Michelle Thompson, and that's actually because she was busy announcing that they're doing something very much in this line in diabetes. So I suspect that one jurisdiction I didn't speak to is going to be very favorable when I do have a conversation. So let me start with, Premier Fury, who I spoke with, who obviously they need to see details. There needs to be a negotiation, but is extremely enthusiastic to work with us on it. It's Adrian Dix in BC, extremely enthusiastic. But let me speak to the 2 jurisdictions that you're speaking about specifically. I'll start with Alberta. I want to say Adriana Lagrange and I really work very well together. We've built a very strong relationship. We worked through the Working Together agreement, and we're able to announce that in December. We're very soon going to be announcing announcing the Aging with Dignity Agreement. I think there's a lot of people who thought maybe we couldn't get that done. And I had a very productive conversation with Adriana on this. And I, from a person, I don't want to infer anything to her. I would just say from my perspective, that conversation leads me to believe that we can find answers, we can find solutions. We want to make sure that every Canadian, and certainly every Albertan, has access to universal contraceptives and to the diabetes medication they need. Now, Quebec, which is the next one. Christian Dubé, similarly, and I are having a lot of tough conversations. Obviously, there's concerns around jurisdiction, and we fully respect those jurisdictional concerns. But similarly, I really believe in those conversations that we can find solutions. Now, that's me characterizing that. You got to talk to Christian for his impression. But I have to say that we had yet another. I was in Montreal a couple of weeks ago. We had a great conversation. We had yet another great conversation yesterday. They're very constructive, and I'm very optimistic we'll find a solution. And I'm very optimistic this is a plan we can deliver across the country.
You have any cost estimates for this yet?
Well, I think part of it is going to be working directly with provinces. So I think that as we roll out each province, we're going to be able to give those details. But part of it is predicated on, having a conversation with the provinces. Some provinces like Nova Scotia just announced a bunch of action. So it's hard for us to contemplate because the provincial targets are moving. So we'll get back to that. It's certainly what's going to happen province by province is we're going to be announcing an agreement in every province and every territory. So my tour of stopping in every province and every territory is going to continue. And at that time, we're going to announce the exact details, the exact dollars, and exactly the action going to be taken.
Annie Bergeron-Oliver with CTV News. Just following up on that, how can you be making a big announcement with this and not even have a rough cost estimate, especially with the budget coming up? You must have a rough estimate about roughly how much this will cost if all provinces sign on.
Yeah, I mean, I think so first of all, it's for budgetary purposes, this is not going to be booked in this year. There may be some costs associated because we may be starting up early. But, in terms of the amount of costs this year, because you're rolling it out, you're starting it, you're negotiating with provinces, this still has to deal with royal assent. There's going to be an opportunity to fully reflect those budget pictures for the 25-26 fiscal year. And the other thing that I would point out that is really important, I really hope to, because I think when we look at BC and you look at the example of contraceptives in BC, they're actually able to get really good data talking about how much money they're saving. So one of the things that I want to be able to do is not just show how much this costs and be able to do that province by province and make sure that it's accurately reflected for the 25-26 budget, but I'd also like to be able to begin to demonstrate in the field of both diabetes and sexual health how much money we're saving, which I think in the early days is going to be pretty darn close to how much we're spending, and I think over the next number of years is going to be actually saving significantly more than we're spending.
So you're saying that there's not going to be any money for 2024. So what is the earliest that somebody will actually have their medication covered? Is that 2025? And part two is, why did you have to have a framework legislation in place to begin negotiations and making deals with the provinces and territories? That's not how you approach childcare.
Well, I mean, I wasn't involved in childcare. I'm involved here, so I can just tell you the experience here. First of all, in terms of when folks will receive it, we're hopeful to sign agreements this year. And so the point that I'm making is there will be some expenditure this year, I hope, if we can get to agreements and we can see people getting access to drugs in this fiscal year. But there's going to be, we have to get through royal assent. We have to get through the process in the House. We have to, negotiate with the provinces. So that's going to take some period of time. And obviously not all the provinces are going to come online at once. So that's very hard to forecast exactly what that is. So, so it's up to the finance minister to figure out, what is the contingency needed for some of those early starters so that we can get medication as fast as as we can. But I want to sign those agreements as quickly as possible. I want to negotiate with provinces at pace. I want to see these drugs delivered to people as quickly as possible. But that will allow us, once we get those agreements, to know exactly what the dollar values are going to be in 25 and 26.
Hi, Minister. Stephanie Taylor with the Canadian Press. Keeping to that theme of the question, how much are you willing to put on the table for this? Does the government seriously not have a cost for this? Like, what is your estimate? What are you starting out? Can you provide a little bit of transparency to Canadians about what you think this might cost?
Yeah, if it's okay, I'm going to get back to you on that. And the reason is that there's still, I do have a quantum in my head, but I mean, some of this, and obviously I've had conversations with the finance minister, but one of the things I want to be careful of is that there are still ongoing pieces with provinces where that's moving. Nova Scotia just yesterday announced that they're doing things. Some of the provinces are already doing some things and may want to change it. So I understand, and I'm with you, and I promise you I'm not going to let this linger for a long time, but I'm going to need a little bit of time to give a quantum of that cost because of the number of moving pieces that have changed just as early as yesterday in some examples.
I guess, though, I'm going to ask again, because you're standing here, you're the Minister of Health, roughly Can you provide any kind of idea? $1 billion, $5 billion, $10 billion? Like, what are we looking at in terms of just a rough cost? You are the Minister of Health. This is a question you knew you were going to get coming out today.
Oh, for sure, yeah.
So what are we looking at here?
So, I think that the quantum is is not an insignificant cost. It would be, in the quantum of, maybe $1.5 billion. Like, I think it's, the question is it going to be lower than that? Is it going to be a little bit higher? And now the problem with that, and you pushed me, so I want to give an answer. Like, I'm not trying to be evasive, but I also don't want to create a situation where when that moves a little bit left and a little bit right, that I am going to be in a position where I'm, you come back and you said it was this, and now it's moved a little over here and a little more over there. These are moving targets. These are obviously not this year expenditures, so I'm trying to project and imagine out into the future, and my staff is already going to be upset at me that I'm pontificating, but I accept their anger, and I'll deal with that later.
Thank you, Minister.
Boris Proulx, journaliste au Devoir, vous imposez des conditions pour que le Québec puisse toucher à l'argent de votre annonce. Pourquoi?
Oui, c'est pas une condition. La condition pour moi, c'est clair. Je veux que toutes les personnes, tous les Québécois et les Québécoises peuvent accéder le médicament pour les contraceptifs et aussi pour le diabète. Et c'est pour moi le façon pour obtenir cette boule-là. C'est pour moi, j'ai beaucoup de flexibilité avec ça. Alors pour moi, ça c'est la raison pour laquelle, quand je parle avec Christian, que c'est évident pour moi qu'on peut trouver une solution. Parce que notre but est d'augmenter l'accès de médicaments. Et je comprends bien que ça c'est le même but pour ministre Dubé. Alors je pense qu'une attente avec cette boule-là est possible.
Dans le briefing technique, il est écrit « On a besoin d'un accord provincial-fédéral pour que ça soit administré par la province ». C'est une condition. Vous écrivez que ça doit être un payeur unique, alors que le Québec a un modèle hybride et pas un modèle universel. C'est une autre condition.
Oui, OK.
Pourquoi?
Oui, non, c'est un bon point. Pourquoi le système est universel? Et je vais répéter mon bout. Mon bout, et c'était certainement le bout avec M. Davies pendant la négociation, de s'assurer que chaque personne avec n'importe quelle condition, peut accéder le médicament. Et oui, dans un certain sens, j'imagine que ça, c'est une condition, mais j'espère qu'on peut... c'est pas une condition, c'est une bout, c'est une bout commune. À mon avis, l'objectif est de s'assurer que chaque personne peut obtenir le médicament. Et j'ai beaucoup de flexibilité de trouver une solution avec ça. Et je pense que c'est un but et pas une condition. Et c'est peut-être vous avez une autre impression avec ça, mais pour moi, c'est pas une condition.
Monsieur le ministre, si le Québec dit non, la santé est une compétence provinciale. Donc, si le Québec dit non, qu'est-ce qui va se passer?
Avec la santé, il n'y a pas... Les juridictions existent pour chaque personne. La santé, ce n'est pas une question d'une province au territoire ou le gouvernement fédéral. C'est la responsabilité de chaque personne. Ici, dans le centre de santé, ici, il y a beaucoup de personnes avec beaucoup de types de responsabilités. La personne ne dit pas « Oh, ça c'est ma responsabilité, c'est votre responsabilité, j'excuse, je dois quitter ». Non, c'est l'esprit et la coopération, de trouver la solution, de dire qu'est-ce que c'est le problème, qu'est-ce que c'est la façon de trouver la solution. Et aussi avec pour Canada, il y a l'Acte canadien pour la santé. On a une responsabilité fédérale de s'assurer l'adhérence de cet acte-là. Et additionnellement, c'est vraiment une question de coopération. Je ne veux pas le chicane. Le chicane, c'est facile. C'est facile de trouver le chicane tout le temps. Oui, ça c'est le travail de le bloc. Mais pour moi, je cherche pour la solution. Je cherche pour la coopération. Et pour moi, ça c'est l'esprit que je vais commencer la conversation avec M. ministre Dubé. Il est quelqu'un tellement raisonnable. Il est quelqu'un qui veut que les personnes avec le diabète peuvent obtenir le médicament. Il veut que les femmes peuvent obtenir le contraceptif. Et à mon avis, ça, c'est une boue commune. Ce n'est pas une question de juridiction, à mon avis.
Mais répondez à ma question, vous allez faire quoi s'ils disent non?
Je vais agir comme normal, dans une façon raisonnable et avec un esprit de coopération.
Hi, Minister. Marco Vigliotti, iPolitics. I think I'm going to ask a version of Boris's question in English, but I understand that the way the bill's written, there has to be negotiations with the provinces and territories about coverage for those two classes of drugs. I'm just curious about the kind of conditions that the Act may put on what that looks like. If a province comes to you and says, we're comfortable doing this agreement, but we don't want to make it a universal access. We want to maybe restrict it to people who don't have private employer plans or people under a certain economic threshold. Is there anything in the Act that would prevent that deal from going forward? Does it have to be universal coverage?
Well, so when Don and we had a lot of conversations on this, and, the PEI has an incredible model. Right, it is a model that's running right now in PEI. It's made a massive difference for Islanders. Heath can talk about this. It's a wonderful program, and that's a pilot, and we're learning. This is also a pilot, and we're learning. We're putting out a universal system, and one of the reasons that universality is important is, let's say you have somebody who has a large copay. Right? I talk to so many people when they have that copay, that makes the difference. They can't afford their medication, right? And we're back into all those things that I was talking about earlier, right? Like somebody making the decision to reuse a syringe, right? Somebody making a decision to skip their medication. And what happens when they do that? They get much sicker. Right? And that costs our health system much more. So, I think with diabetes, on the one hand, it's extremely important that be universal. We want to make sure for all the stress, and you talk to Raina, like all the stress of having this chronic disease, you don't need the additional stress of whether or not you're going to be able to afford it. This takes it off the table. I think that's something we can all agree to. And then when it comes to contraceptives, similarly, when you're talking about women's health and women's reproductive rights, you don't want to leave it to the chance that somebody can't afford to get what they need. And so for me, and for Dawn, I don't want to speak for you, Dawn, but I think these two classes of drugs, surely we can all agree that everybody should have universal access. There's some who are going to debate about whether or not all drugs should be under that model. I know Dawn has very strong opinions about that. For me, I want to make sure that everybody gets the drugs they need and that costs aren't a factor. And that's the world we want to get to. And we want to get there as fast and as efficiently as possible. And this is why the PEI model that exists, and now this model that exists, is going to move it out of theory. It's going to move it into practical reality so we can see how these things actually function, work, and save money.
Okay. I actually have a question for Mr. Davies.
Yeah.
Considering the legislation we're seeing right now is fairly limited in terms of its applicability, and considering we're only talking about two classes of drugs that we got guaranteed coverage for, how can the NDP frame this as a win for its plan to get universal single-payer pharmacare?
Well, the legislation does two really important things. For the first time in history, it will see the delivery of two classes of drugs through a universal single-payer model. I think Mark has used the term proof of concept before. We've had a lot of studies and task forces, including the Hoskins Advisory Council on Pharmacare, which consistently recommend that that's the fairest, most cost-effective way to deliver pharmaceuticals to people on a universal basis. So, that's history. That's the first time that we've ever seen pharmaceuticals folded into a single-payer model. But the bill does more than that. It also sets a structure for builds a foundation for further expansion down in the future for governments that want to go there, and of course the New Democrats. If we're government, we would want to go there. So it has things, the legislation has things in it, like there's a reference to when the Minister of Health is negotiating with provinces to consider the Canada Health Act. Where we put in and have enshrined in legislation two very important building blocks of universal single-payer pharmacare, which is the development of an essential medicines list and a national bulk buying program. These were two features that were negotiated in our confidence and supply agreement that are now enshrined in legislation, and the legislation says those have to be done within 12 months of royal assent. So we will continue to make progress. And finally, think of that essential medicines list. In 12 months after passage, we will have the next slate of drugs that would be at least on consideration for how we expand this for a government that is prepared to do that at that point in time. So what have we done? We've built a foundation for future expansion of single payer if we want to go there, and we're delivering two drugs through a single payer model.
Hi there, Minister Holland. Marina von Stackelberg with CBC News. Reading the language of the bill, it's unclear if you're committing to a single-payer system beyond the diabetes and contraception categories. Why is this, and will you commit today to a universal single-payer drug coverage for all medications?
So I think going back to the question, why these two drugs? I think that there is an opportunity in evaluation in a real-world model to see how it works. One of the things, whether or not we look at the Hoskins report or we take a look at the PEI model, which we're learning an enormous amount from, is that most of this was held in the imagination and theater of our minds. So bringing it into the real world so we can see how these effectively function, what are the costs, how much do they save, how would we pay for them? Associated with this is a committee to take a look at many of those questions so we can go deeper. And I think that, rightfully, we need to be iterative about this to make sure that we're moving in the right direction and choosing the right system. To answer your question directly, this is, to me, this is a proof of concept opportunity to try on two drugs on a universal single-payer model, and that we're going to have an opportunity to evaluate the effectiveness of that model. And I think in a real-world sense, we're going to be able to look at the PEI model, which is based on a different approach, to see what is the effectiveness of that model. I think the question that Canadians are going to ask, once they get an opportunity to look at that data, is to say what is the most effective, efficient model to get to full coverage, to make sure that everybody can afford their medication, and that we choose the system that's right for that. And having two real-world models that we can contrast and learn from, I think is going to inform that debate in a very essential way. And so, and this is a debate. Obviously, it's a huge part of the debate is that I'm an incrementalist, right? I try to categorize it to get people more excited that I'm a radical incrementalist, right? Whatever it takes. But I mean, that's how we get progress, right? You do a little bit and you evaluate and you learn and you use that evaluation and science to inform your next step. And I think that showing that prudence, showing that we're taking each measure in its turn and choosing two areas where we can have the highest impact as to really learn is the prudent approach.
So it's a wait and see situation.
If you wanted to characterize it that way.
Okay, that's not my question too.
Well done, well done.
So you've got these two categories of drugs right now. If and when you decide to add more drugs into this coverage plan, are you going to do it all at once? Are you going to choose another category of drugs, a specific type of medication? Are you looking to kind of do these two, as you say, proof of concept, and then add all other drugs that you think should be included?
I think that, look, there's going to be a committee that's going to be looking at the practical realities of this. We're going to be having the opportunity to have really in-depth conversations that I've already started with my provincial and territorial counterparts. As I said, I had very constructive conversations with 12 of 13, and Michelle I've had great conversations with her before, just not in the last few days. And so I think, where the future is, I say this often. I'm not clairvoyant. I'm not a psychic, so it's hard to know where this information is going to lead us. But we have to be led by the data. We have to be led by the science. And I think it's one of the problems of the debates that we have is that we get caught in, making bold declarative statements and tweets and slogans. Sure, they sound great, and maybe they may represent good retail politics, but hopefully people instead are saying, what's the data say? What's the science say? What does the evaluation say? And that's slower. It's more cumbersome. It's less juicy. It doesn't sizzle the steak the same kind of way, but it's enduring and it's real. And so the reason that I don't want to get into pontificating about what a future might hold is that the work that this committee is going to do, the evaluation that we're going to do on the PEI model and on this model now that is being launched with these two classes of drugs is extremely important. And we're going to continue to be led, as the Prime Minister says, in all of our decisions, as I know my colleagues feel completely the same way, by science, by reason, by evidence, by evaluation, not by feelings and slogans and what looks good on a bumper sticker.
We'll now go to the questions online with Mark.
Thank you, Chris. We have one question from a journalist on Zoom. Nous avons une question d'une journaliste sur le Zoom. Tessie Sanchi with the Hill Times. Please go ahead, Tessie.
Thank you so much for taking my question. I'd like to direct my question to both Minister Holland and MPs. Just wondering if you can provide any insight. I mean, we are basically one day before the deadline. Any insight into the conversations that led to this agreement where it seems like both of you compromised a bit?
Yeah, absolutely. I mean, I think Don is going to want to speak to this too. You know, we started with very high-level philosophical conversations in great distance, and then there was a process of really moving in together. And you know, and it was hard, I think, you know, because every day I was asked by the press gallery, "What's happening with this? Where are you guys at?" And very earnestly, I was saying I can't really say because you know I didn't know, and I don't think Don knew. I mean, I think we were talking with our caucus and really hearing from our caucus, and we were hearing from other parties. You know, we're hearing from advocacy groups and stakeholders, and trying to merge all of that in as well as conversations with provinces. But really, where it came down to is there were 6 days where we spent as a Tiger team, folks from either side, you know, getting together and getting that last mile done. And it was, and what I was impressed by with that again is that there was no conversation whatsoever about like how do we roll this out or how do we try to get credit. It was all just about like how do we improve things, how do we focus on the areas where we agree, where we know we can make a difference for Canadians. And you know, and it's hard. I mean, fortunately for Don and I, we work together in opposition a lot, so I think there was a lot of established trust. And in a process like this, you have to take some chances, right? That the other person isn't going to burn you, that they're actually there in the spirit that they say they are. And I can say at the end of this process that Don absolutely was there in that spirit, and it's evidenced by the results that we have here today. Don?
Well, I'm a middle child, which I think was critical. You know, any agreement does require compromise. I think we've got the best of both worlds, frankly, in this legislation. The NDP laid down a pretty hard red line that we needed to make progress towards single-payer pharmacare. And in this legislation we did. And I think on the Liberal side, you know, so I'd say that, you know, the NDP's principle and drive towards making progress in that vein was what we contributed to the debate, and there was a lot of pragmatism and skill and experience that Mark and his team brought from their side as well. You know, it's a very rare thing in politics when an opposition party and a government come together, you know, in confidence and work on something and produce something that both sides are content with. And, you know, that's the essence of, I think, skilled politics. I think it's, as Mark said, I think it's something that is all too rare in Canada and that Canadians want to see more of. But it has to be done with principle. And I think this is a principled piece of legislation. That both sides, you know, we would have liked to have started with the essential medicines list. You know, I think we put that on the table. That proved to be perhaps a step too far. So, you know, to start with two major classes of drugs in this country that are so impactful for millions of Canadians, that was a compromise I think worth making. And I do think you know, we in the NDP believe that universal pharmacare is ultimately a cost saver in the end. Many studies have come to that conclusion, and Mark has emphasized that today, and we're seeing that happen in provincial studies. But as Mark says, as we build the system, as our healthcare system was built, by the way,
That's a good point.
was incrementally, we can actually have that proof of concept. I'm more confident that we'll get there, maybe than Mark is, but the fact that Mark is open to that was that collegiality and open-mindedness I think was really, really welcomed by our side and was a key to us getting the deal. So really, you know, the melding of principle and pragmatism resulted in this historic day today.
Thank you.
Oh, I was a Teamster lawyer as well. That with the middle child, that kind of. I think.
Thanks. That's it? Or is there a
No, I have a follow-up.
Yeah, supplementary? Yeah.
Yeah, thank you. It is Rare Disease Day, and there has been no word on bilateral agreements that your government promised almost a year ago. And now you're saying that this bill has not passed yet, but you're saying you're adding another set of bilaterals to your to-do list. So that leaves you with 4 sets of bilaterals. What would you say to rare disease patients who are still waiting nearly 1 year later for one bilateral agreement to come out, for just some hope that the spending is going to go through?
Well, I met with a number of folks yesterday who represent the rare disease community. One of the patients was Maureen yesterday, and Maureen was talking about her lived experience and just how difficult it's been. She was diagnosed at 8 with a rare disease. And seeing the community, the rare disease community, come together and bond with what they have in common, because individually they're completely alone, but they've now come together in a very powerful way to be an advocacy group. And yeah, I mean, look, sometimes I wake up in the morning and look at all that we have to do and negotiate and think, how the heck are we going to do it? But we are doing it, and we will do it. And I have to say, part of the reason we're going to do it, and it's the spirit that I saw in Charlottetown with the other health ministers, different political parties. I think it's the spirit you're seeing here today with Don and I. You know, the fact that Adriana Lagrange and I, who have so many differences, can talk so constructively about how we can find a path forward and work together. That's why we're going to get these agreements done. We're going to get them done on rare diseases. We're going to get them done with aging with dignity. We're almost there on getting all of the ones done and working together. We're going to get them done on pharmacare. So yeah, it's a tremendous amount of work. But you know, I have the extraordinary privilege and opportunity given to me by the Prime Minister to try to make better our health system. And I am trying with every ounce of my being, with Yasser, who I'm so excited to have as a parliamentary secretary, and my incredible colleagues, to do this. We have to. You know, we've got one of the best health systems in the world, and when you go around, just go around, right? Like, just go around and talk to the people who work here. We have the best people working in healthcare anywhere on the planet, right? All we need to do is have one focus. All we have to do is pull with one purpose forward, make things better, you know, and it seems daunting. For sure it's daunting. It's daunting for me. But, you know, despair gets you one place, nowhere, right? And there's no reason to despair. When you see what's possible, it invigorates you. It's a lot, sure, but we're going to get it done. Thank you.
Thank you, Minister. This will conclude today's news conference. Thanks for your participation.